There have been more than 350 confirmed cases of Ebola and more than 60 deaths, according to the World Health Organization. But the full scale of the outbreak is still unknown. The WHO has declared the outbreak a public health emergency of international concern. So far, cases have mostly been concentrated in the Democratic Republic of Congo, but some have been reported in neighboring Uganda. Ebola is one of the world's deadliest viruses and can spread rapidly through direct contact with bodily fluids or contaminated surfaces. Dr. Ashish Jha joins me now. He was the White House COVID-19 response coordinator in the Biden administration and is now the co-founder and CEO of the biointelligence firm BioRadar. Dr. Jha, welcome. Tell me first, how bad is this? How serious is it? And are you worried that it could in fact spread well beyond Uganda's borders, perhaps even to places like the United States?
Yes, Fareed, thanks so much for having me back. This is a bad outbreak. Right now, it's the third worst outbreak of Ebola we've ever had. I think it will quickly become the second worst as more cases get identified. My sense is that this outbreak began probably 2 to 3 months ago and it's been spreading quietly. And we are far from getting our arms around it. So I think this gets much worse before it gets better. I certainly worry about other countries on the African continent. And I would not be surprised if we see at least a few cases ending up in Europe or maybe even in the United States.
Now, there is something that people say about Ebola, which I wanted to run by you, which is that it's a virus that tends not to spread in quite the way that COVID-19 did, like wildfire, because, sad to say, tragic to say, but it kills people much faster than COVID would. Is there something to that it sort of burns itself out because of the very vicious nature of the virus?
Well, there is a general view that more deadly viruses spread a little less easily. I mean, obviously, to some extent, if the patient dies, you have less of a chance. You can still spread this virus quite efficiently. The difference between this and COVID is obviously COVID spreads through the air. This is through bodily fluids. The second is COVID can spread when people don't have symptoms. That's not true for Ebola. Ebola, people spread it when they have a fever, when they're sick. So that's why it tends to be not quite as transmissible. But boy, lots of people can still get quite sick so lots of people can still get infected from Ebola, and obviously lots of people get sick from Ebola.
What do you think has gone wrong with the Trump administration's kind of detection mechanisms? Because we heard about so many cuts from USAID to cuts to international public health, withdrawal from the WHO. Did all this have an impact?
It undoubtedly did. Look, USAID was our boots on the ground. That was where we had people in countries helping health systems. We had a lot of people in the DRC. Those people were eliminated, their positions were eliminated. My view is if those positions had still been there, those people would have been there, they would have heard about the outbreak, they would have known something was spreading. And we would have gotten our arms around this much faster. The second is once Ebola has been identified in the past, it happened 12 times during the Biden administration that Ebola or its close cousin Marburg was identified. Immediately a phone call went to CDC, CDC sent in people, CDC sent in testing, and that's how we stamped these things out. That phone call just did not come this time, and there was nobody at CDC to take that phone call in the same way. So everything has gotten substantially weakened by the Trump administration, really by the Kennedy strategy on health, and that has left us much more vulnerable to these kinds of outbreaks.
If you were back in your job in the White House, what's the one thing you would advise the president to do now?
Well, the first and foremost is you'd actually want a coordinator at the White House. We don't have one. For things like this, you need all of U.S. government approach. CDC has a role, state has a role, often the DOD has a role, others have a role. You need a senior person basically quarterbacking. Right now, the U.S. government doesn't have a quarterback. It has a lot of people on the playing field playing the ball, but without anyone coordinating. So what I would say to the president is name a quarterback and give them the authority to do whatever it takes to get this outbreak under control.
Ashish Jha, pleasure to have you on.
Thank you.